When I was 14 years old, I got into a car accident and I hit the right side of my head. And a month after that car accident, I had my first grand mal seizure.
Like any good mother, Chrissy Goodman has a special bond with her daughter, Madeline, loving, nurturing, and attentive. But there was a time when such a relationship was nearly impossible. Even when she was carrying Madeline, Chrissy's epilepsy was so severe she could barely function.
It became where it was 2 each month and then 3 each month. And then when I got pregnant with my daughter, I had over 200 seizures throughout my pregnancy. And my worst was 18 in one day. It just got to be where my seizures would rule my life. If I do go into a generalized seizure, I am unconscious, and I won't know I had the seizure until I either wake up in the emergency room or I'm lying in my bed 2 days later wondering what happened.
Chrissy's physician referred her to Dr. Barbara Jobst at Dartmouth Hitchcock Medical Center.
Dr. Jobst is a wonderful woman. She's a friend of mine. I mean, I couldn't ask for anybody else to take care of me.
She was fairly young when I saw her first. She may have been like 18 or something, or 20. But she was very, as I say, very intelligent. Wanted to actually become a neurosurgeon. But we couldn't get her seizures under control.
Dr. Jobst wanted to see if Chrissy was a candidate for surgery. Removing the source of the seizures is often the best treatment, but that depends on where in the brain the imperfection is located. Surgeons can't operate in certain areas of the brain.
We found out that her seizures are coming from the left temporal lobe, but if we would take it out, then she probably would have a significant memory deficit.
Until quite recently, surgery to remove the spot in the brain would have been Chrissy's last hope. But Dr. Jobst asked her if she wanted to take part in the study for a new device called a responsive neurostimulator system.
It works kind of like a pacemaker would for the heart. And it would pick up any abnormal electric activity in the brain and then kind of fire back to stop that activity from furthering into a seizure.
Whenever it detects a seizure or some abnormal activity, then it delivers a stimulus to kind of influence the seizures or modulate those seizures, or even abort the seizure.
In the study, surgeons implanted an RNS device into Chrissy's skull and brain. To implant the device, the surgeon drills holes in the skull and precisely inserts probes into areas of the brain where the seizure activity originates. All of the measurements and locations have been carefully mapped based on MRIs. He then places the transmitter into an opening he has made in the skull and connects it to the probes. The device is tested using predetermined settings to be sure it's working. These settings can be adjusted later and readjusted at any time without performing another surgery. The surgery changed Chrissy's life. Her seizures happen far less often and are less severe. They may be gone for good.
I haven't had a seizure for 2 months now, and if I can make it 6 months, then I can drive again.
I don't really know a lot, but all I know is they took very good care of her and they put a little thing in her head that makes her stop having seizures.
Before the trial, my life revolved around my epilepsy, what I could do in a day and what I couldn't do, plans with my family, having to cancel engagements because of having seizures. But now, since I have this device and it's working, I don't have to fear having a seizure when I'm going to do something with my daughter or my family or even for myself. Since I've had this implant, I've gone back to school. I'm finished and got a certificate in medical assisting, and hopefully I'll work sometime. My daughter and I got invited to go to the FDA to plead to them on why they should approve of the device. I remember when they called my name, when it was my turn to tell my story. I had my daughter with me. She got to stand at the podium with me. Now, she wrote a story herself in her own words, and it was just precious, on why they should approve of the device.
I wrote this little, 2 or 3 page story, and it was about how my life changed.
Having the NeuroPace allows her and I to have the closest thing to a normal life, and I, Madeline Goodman, am very thankful for that. She wrote that all by herself. I'll give that right back to you. Thank you, honey.
The new responsive neurostimulator system won approval from the FDA in November of 2013 and is now a choice for any patient, like Chrissy, whose life could be immensely improved by this new implant device.
It doesn't cure all seizures, but it helps. So I don't want to kind of put all expectations out there that it, when you get the device, you're all cured, but it makes things significantly better, and that it's less invasive than we really think. I want to really advocate for my patients. And I think the patients, as I usually say, the patients are the heroes. Like Chrissy is a hero. It's not me putting this thing in. It's them.
There.